Well, good evening, friends. This is Michael Clapier from Max International. It's my pleasure to greet you this evening for what I think you're going to find is a very interesting short meeting. I just want to let you know how grateful I am for this audience, for the people on this call. I know that you are the movers, you are the happening, you are the people that make life, the Max life exist, and we appreciate you for that. My responsibilities at Max are to be a liaison with you, and I have interacted with many of you on many occasions. I always appreciate our time together. I always appreciate your support, and I was ecstatic to see the way things turned out in our recent event. I wanted to share with you a couple of instances that set up what we're doing here. First is the first time I heard Joe Wojtycki tell his story of what the science, when he fully understood what the science was behind our product, he not only endorsed it, he changed his life. And you know the story. He was a Wall Street lawyer working on big deals, came and did the legal work for the acquisition of Celgevity by Max International. And with Celgevity came Dr. Herbert T. Nagasawa, Scott Momi, and the intellectual power of their research. And I thought, man, a Harvard educated guy could listen to that and have that experience and change his life. There's got to be something powerful here and something deep. So that was number one. The second thing is that we've always had people talk about our science and want to question it and want to look at it and want to understand it. And so when I heard about this initiative that is going to come to fruition as the Max Symposium, that you are here to understand how to invite people to that symposium, and you're going to hear a lot of great information tonight. But when I thought about what that opportunity represented, I had a conversation with my healthcare provider, and I spoke to him about glutathione, and it became a very easy conversation when I realized that because he knew what glutathione was and he had an interest in understanding more about it, it was very easy to say, my company has a nutrient that is absolutely the real thing. It's patented. It does what we say it does, and it allows the body to get the nutrients directly to the cell. And he said, "You got to be kidding me," because he utilizes glutathione injections. He knows the power of it. I said, "No, I have an upcoming symposium. Would you like to be invited to it?" He goes, "And learn more." And he said, "Absolutely." And so then we started having conversations and producing this, and I got to be able to be invited to and a part of this development. I got to know Bobby Horn, and she has this. She understands what we're trying to do and the depth of where we're going. And so I hope that makes sense to you. It's my great pleasure to turn the time now to Miss Bobby Horn, as she will take you into the step-by-step introduction of how we can effectively take this science and reach out better to the medical people who want to understand it more. Bobby, I hope that wasn't too stumbling.
I think it was perfect, Michael. Thank you so much. And I have to be honest, it was when I heard Joe Wojtycki speak, it's been almost 11 years. 11 years ago in Las Vegas, the first time I heard him speak, I said, I know now that I have joined the right company, because he made a decision that was pretty dramatic, to leave a Manhattan law firm where he was close to being partner, to make a decision to partner with Max was a huge decision. But I always have felt, because I came out of the medical community, I always felt that we needed to do a better job of reaching out to the medical and to the health professionals. So the journey really began in January this year, when at the Max event in Mexico, um, Janet Moriyama from Canada came up to me and she said, Bobby, I'd like to set up a time to visit with you to see if you could help me put together a medical symposium. And so that's when the conversation began. And I absolutely was thrilled that Janet had invited me to participate. We started working with the Max corporate team. We had team meetings with all of the Toronto folks who were involved in planning the symposium. And quite honestly, we were all just so disappointed when we realized in probably March or April that COVID was not going to allow us to have an event in person. So we switched gears and we said, okay, what else can we do? What can we do to bring this symposium to life? We had already invited all the speakers. They had already agreed to do their presentations, and we had to decide what we were going to do next. So I think it was actually John Hobbs out of Canada who suggested that we put together a virtual symposium. And we said, gosh, we think we could do that. And with John Winterhaller's help, we started working on it. And I was absolutely so thrilled to be working with this team of people. And you know how some ideas just get bigger and bigger with time? Well, this one did. So that is where we got started. And we said, you know what, we cannot keep this just as a regional event. We really need to make it global. But instead of just having a symposium, why don't we take the time to actually train people how to invite to this symposium so that they are equipped with the same skill set that over 30, 40 years in the medical industry I've acquired. So why don't we teach people how to do that so that they become more comfortable? So this is what we're presenting today. We're going to teach you how to invite medical and health professionals to the medical symposium. So we know we have something just really brilliant. We just need physicians to understand that as well. So I'm going to try to advance my slides here, Mike. I'm having a little struggle. So let's see if it'll work. Okay, here we go. So this is what we're going to be talking about today. We're going to be talking about educating the medical and health professionals on Max Science. What was it that made Joe Wojtycki leave his Manhattan law firm? And the same thing for me when I made a decision that I wanted to be part of this company, it was the Max Science. We recognize that the regulations and the restrictions in each market are different. We have some folks on the line with us tonight who are from Canada, and people in Canada know that the rules and regulations are not the same in Canada as they are in the US. So we have to understand that. We want to show you the goals and the topics of the presentation that we're going to have and who we should include. We want to tell you who would benefit from hearing this information. We're going to show you a sample invitation so that we can just verbalize what it is. And we're going to show you the registration for the attendees for the symposium and the information that we want to gather so that you have the benefit of being able to follow up with them. We're going to fine tune some of your language so that we can remove the barriers that sometimes prevent health professionals from taking a look at what we do simply because they have one obstacle, and we'll talk about that. We're going to have a post-symposium deliverable, which is going to be a bibliography of all of the cited studies. And so that's part of the reason why we're gathering the information about how to get in touch with our attendees after the fact. So let's talk a little bit about what the challenges are for medical and health professionals. We know what our challenges are in our industry, but let's talk about them as well. So, they know that patients are used to using nutritional supplements, but how do they know that they're effective? Or worse, how would they know if they're dangerous? And oftentimes in clinical practice, a patient will show up with a bottle of this or a jar of that, and they will say to their health professional, "Doc, how does this look to you? Is this something I should be taking?" And quite honestly, the doctor has no way of knowing because they don't know where it was manufactured. They don't know if it was a good manufacturer. They don't even know if the ingredients that are on the label are in the product or what's in the product is on the label. There's also a lack of time and resources because their staff is not trained to specifically look at nutritional products. So they need to know whether or not the products that they might recommend are both safe and effective. They don't know who to trust or even where to find the science. And that's our job, is to show them both of that. that they can trust us with the information that we're delivering to them, and we can show them where to find the science. You know, professional liability is especially important here in the United States because doctors are sued frequently. So they need to know that they are protected, that there's credible research and science that justifies recommending a supplement. So if a patient comes to them and says, "Doctor, can I use Celgevity or can I use Max One?" they will know whether or not it's safe. Health professionals, for the most part, are wary of network distribution. And I use the word network distribution because that, in essence, is what we do. Network marketing, in sometimes, really probably 25 years ago, you used to buy products and sell them to people that you sponsored. Well, that is not the way it works anymore. Typically, the company ships product directly to our consumers. But when health professionals hear network marketing, they sometimes turn away and they say no before they ever see the science. We would like to change that. Obviously, medical and health professionals have terrible time constraints. They may not have time to build a distribution team, but they would like to be able to offer the products to their patients, and we need to find a way to help them do that. So they need really simple tools to help educate their patients, to use videos and websites. They want a tool that even their office staff can say, "You know what, we'd like to tell you about something that we recommend, and here's a tool that you can go and take a look at. May I text it to you?" A simple tool that they can text to their patients would be a great tool. And we also have to always be concerned about adherence to government and regulating bodies and the restrictions that they have. We never want to put our medical community in jeopardy because they use our products. So we're developing a Max Medical program. So what this means is it's going to provide a platform so we can train you, our very, very valued Max associates, to effectively introduce ribosine science and the other science within the Max product line to medical and health professionals through professional education tools and trainings. We will develop, along with this very first symposium, we're going to develop a series of symposiums and webinars to help build a Max medical community. You know, we have some medical professionals around the world that have done just an amazing job of having doctors being part of the business. Other countries do a really, really excellent job. We want that same thing here in the United States. We want the same thing in Canada. We initially would like to have these symposiums be virtual. Ultimately, we would like to have regional events, and we will need the help of every single Max associate to help us do that. We'd like to create an option for medical and health professionals in those markets in which it can work, who want to take advantage of, you know, they may not want to take advantage of the network distribution model, but they still want to offer the products to their patients. So how do we do that? Now, that's going to be very country specific. No country is going to be exactly the same in what we can and cannot do. But we want to be able to explore that with your help. We want your input. We want to know what will work in your country. And then this will be able to produce an additional avenue of both product volume and income for our Max associates. So let's take a closer look. We want the rules and regulations within each market to be understood. So we want to gain a really comprehensive understanding of your country, your market, and what restrictions are in place for medical and health professionals when they both present and educate patients and clients on nutritional supplements. We want to develop a company guideline to ensure compliance in each of our markets. We never want to be on the opposite side of this, and we are so fortunate that we have both Joe Wojtycki and Jim Stavralia, who are part of our corporate team, because they make sure that we don't step over the bounds of what is legal. So here's what we're presenting for our Max Medical Symposium, and I think you're going to be astounded by the two people that we have presenting here. The very first presenter is a dear friend of mine. Her name is Dr. Margie Smith. She's a molecular geneticist, and she is the owner of Smart DNA. You're going to find out a little bit more about her, and you're going to be quite surprised at her acumen. And then we have our blessed Scott Nagasawa, who is PhD and Doctor of Pharmacy. Our topic for this event will be the immune system. So Dr. Margie Smith will talk about the immune system and nutritional immunomics. That basically is how nutrition affects the immune system. Then Scott will present glutathione as an antioxidant, a detoxifier, and an immune system enhancer. So let's take a look at Dr. Margie Smith. She's really outstanding. She's been a molecular geneticist with over 20 years of experience in neurogenetics and cancer genetics. Now, Margie lives in Australia, but she's originally from New Zealand. She's a brilliant scientist who's worked in major teaching hospitals in both of those countries. She has collaborated to develop methods to enable cost-effective breast cancer screening in diagnostic labs in Australia, New Zealand, and Canada. She's recognized for her contribution to genetics. She's absolutely brilliant. And full disclosure, I am a practitioner with Smart DNA, so that's why I know Margie so well. She was appointed to the Human Variome Project as the scientific associate of the Genomic Disorders Research Center. She's an associate investigator for the NH and MRC grant application for funding to provide a database for collection of sequence variation. You can tell she's pretty darn smart. She's a member of the Victorian Operative Oncology Group, which is cancer genetics. She is co-founder of Smart DNA, which is a nutritional genomics company. And basically that means that that company actually takes saliva, they test it, and then they look at your DNA to be able to understand what you can actually improve through what you eat, how you drink, and how you supplement. And that's where Margie is a very, very good friend to Max International because she understands ribosine science. She's also author of the book Gene Genius: Understand Your DNA and Create Your Own Genetic Roadmap to Health and Happiness. So this is her topic: nutritional, the immune system. One size does not fit all. And this is focused specifically on immune health, which is so incredibly important, especially as we're undergoing really, really rampant COVID here in both the United States and Canada. The second part of her conversation with us for the medical symposium is about the risk factors that occur specifically for cardiovascular disease as a result of COVID. So she'll talk about the role of glutathione, she'll talk about the role of zinc, she'll talk about inflammation and reactive oxygen species in tissue recovery. As you can tell, this is a very, very high-end presentation. It is one that you will be proud to be able to invite medical and health professionals to. It's an amazing topic, and I have actually gotten to hear the presentation. It's just outstanding. This is just one of the slides, and I can tell you I don't understand this completely, but if you take a look, this happens to do with cellular health and why zinc and glutathione are so incredibly important, especially as you recover from COVID. So there is some COVID discussion, but it's primarily around the immune system. We'll make sure that your doctors get a copy of the bibliography for this. And our own Dr. Scott Nagasawa, who we love, who is the Director of Product Research and Development for Max International. He is a PhD pharmacist. He is also a college professor. He is a clinical instructor of pharmacy practice, and he's an adjunct professor at the University of Southern California. He has a really successful history as a senior VP of professional services with a national pharmacy provider. He is co-owner of a regional home infusion pharmacy, and of course we know him for the development, along with his brother Dr. Stuart Nagasawa, with his father Dr. Herbert Nagasawa, who we all love, and Scott Momi. And they brought Celgevity to the table. They brought that ribosine compound to our company, which we so appreciate. So this is Scott's topic. He'll talk about the research and development of ribosine. Now, he does a great deal of education in this presentation about glutathione. He wants to help us understand the role that glutathione plays in the body. Keep in mind that not every physician that you might invite to this will understand the role of glutathione, but we will help them do that. So he's going to help us understand the science. He will talk about the antioxidant defense system. He'll do an introduction to glutathione biochemistry. Keep in mind, not every physician has heard this. He will talk about glutathione as an antioxidant, a detoxifier, and then the immune system. He'll talk about the causes of glutathione depletion, why it's so important to the body. And then he'll talk about ribosine, the research and development behind ribosine, and then also the early proof of concept studies, so that he will help your audience, your invitees, he will help them understand this. So this is our schedule. So for the next few days, and I didn't even include the 19th, which we added later. So for the next few days, we'll be doing associate field training on how to invite. That's the 16th, 17th, 18th, and we just added the 19th for Canada. So we'll start sending invitations as soon as we actually hear this information. Registration will take place December 21st through January 22nd. That will give us time to be able to make sure that all of our attendees, the ones who have registered, get invited to our webinar presentation. Registration by attendees will be required, and we're actually going to gather some information that will be very, very helpful for you going forward so that you can actually follow up with your invited guests. So we'll include name. If they're a health professional, we'll include credentials and the area of practice. We'll also gather email address and mobile phone, and there's a very, very specific reason why we're doing that. So here are some of the health professionals that we would like you to consider inviting. Really, anyone who treats diabetes, heart disease, hypertension, obesity, and I have another one hiding under my screen here, and I'm going to move my screen a little bit, and stroke. So here are the health professionals that are those who primarily treat those conditions. Now remember that we do not diagnose, treat, or prevent disease with any of our Max products, and we have that label on everything. But keep in mind that all of these health professionals and medical professionals understand the power of nutrition and the important role it plays in cellular health, and what it can actually do to prevent disease, and what we really can show in the field of immune health. So family medicine physicians, internal medicine physicians, those who treat older adults, integrative medicine, cardiology, which is really, really big right now post-COVID, because anyone who's experienced COVID is going to have some kind of cardiovascular involvement. Endocrinologists, gastroenterologists, nurses and nurse practitioners, obstetricians and gynecologists, pediatricians, and podiatrists. Why would we include podiatrists? Well, guess what? If someone is diabetic, oftentimes a podiatrist is going to know it first. Either that, or their dentist, or their ophthalmologist. We also would like to invite clinical research. We really want clinical researchers to know what we're doing. We would like to invite chiropractors, dentists and oral surgeons, diabetes educators. Wouldn't that be a great group to invite? Dialysis clinics, where people with kidney disease really would want to know what we do. DNA practitioners, naturopaths, nutritionists, registered dietitians, pharmacists, and physical therapists. Let me switch gears here. Okay, so let's talk about how we invite. We would like to provide you with a suggested script. Now, keep in mind, this script may not be for everyone. We would like to provide you with a go-by, something that you can try and you can modify. You can make it to your own language. You can make it to your own culture. If you don't feel comfortable with the words, we want you to be able to change them. So we want you to be able to adapt that script. We're going to do email invitations that you can send out. We'll post those on the Max blog. We will have a text invitation. I've discovered in working with physicians lately that most of them would really, really prefer that you communicate with them by text instead of by email. In fact, most emails are never opened. We want an invitation that can be printed if you like. You can actually print it out and you can hand deliver it. to a physician's office. So here is your sample. This is your go-by. So this can be very conversational. I'm going to read it the way I would say it to, say, for example, a cardiologist. I might say, you know, doc, I know your practice works with patients that are diagnosed with both cardiovascular disease and diabetes. I wanted to invite you to a medical symposium sponsored by the company I've worked with for the past 11 years. The first presenter is Dr. Margie Smith. She's a molecular geneticist, and she will be presenting the genetics behind the immune system regulation and how you can help your patients reduce their risk for diseases like COVID. You will also have a discussion of the potential for cardiovascular damage with COVID, which you probably know about. The second presenter is Dr. Scott Nagasawa. Scott is a PhD pharmacist and a pharmacy school professor. And he'll be talking about the antioxidant system, how to increase cellular glutathione, as well as recent studies around glutathione in the immune system. Symposium is actually going to be online, and it's by invitation only. Would you like me to include you? And if you would like me to include you, would you like to receive the invitation and the reminder by email, text, or WhatsApp? What's most convenient for you? Most physicians will tell you that they would prefer text or WhatsApp. Believe it or not, that's the preferable tool these days for communication. So, obviously, we would like you to practice an appropriate invitation. Here's why. Your physician is running a business. So we ask you, please, please do not invite a physician to this presentation when you're sitting on the examination table as a patient. Why? Because your physician has overhead. He or she has overhead expenses, and when you're in their clinic, that is their billable time. So just like if you were, working in a facility where you got paid by the hour, but only based on the number of people you could see, you would understand that. So that is not an appropriate time, but typically most physicians, most medical practices, most health professionals will take meetings during lunch hours and actually after hours. This is their time that they can book. But guess what? If you start to develop a rapport with the office manager and the front office staff, they are your best friends. They're going to be able to really tell you who you need to develop that relationship with, and they're going to give you a clue how to reach out to their physician the best way. So here's a really simple question. Who makes the doctor's business appointments? What would be the best way for me to be able to do that? And I can tell you that it makes a big difference when you actually ask those questions. So here's your call to action. You're going to develop your invitation script. You're going to be checking out the Max blog, and if you have not subscribed to the Max blog, please do. We will actually have the registration page there. We'll have an invitation, a PDF that you can print and email. We'll have a JPEG, which is for your texting. So if you want to be able to pull off a JPEG from the blog and text it to any of your invitees, you can. Also check the Max blog for updates, because that is where we will post them. So here are the dates for the symposium: January 27th, 28th, 29th, and 30th. Now, registration details will be posted on the Max blog. And you might say to me, well, wait a minute, Bobby, what if my doctor, the one that I really want to have take a look at this, is not available any of those dates? Have them register regardless. They will be given a login and a password, and we will make the recording available to them after the fact. But it will be password protected. We do this to protect us really from our competition. We just assume, that our competition doesn't know that we've stepped up our game and we are really going to provide information to medical and health professionals that has never been provided before. I invite you all to take a role in this. I invite you all to take a second look at this invitation, understand what you want to provide, and go and have a visit, even just in your community. If you go and visit with 2 or 3 or 4 physicians, if you go to your local physical therapist, if you go to your local chiropractor, reach out to those people that you know would want to take a closer look at what we're doing. I thank you so much for your participation today. If you have any questions, I want you to be able to email them to me. In fact, we have a team of people that will be standing by to answer any questions that you have. And here's the email address. If you'll just quickly jot it down, it's maxtraining, M-A-X training at max.com. Again, maxtraining at max.com. We want you to be able to share your questions, concerns, ideas with us. We have people who are presenting this invitation all over the world for Max, and I'm just so excited. We had our first presentation in the Philippines last night, and we have presented in Ecuador today. We presented in the US and Canada, and then we'll have another Canadian presentation on Saturday. We will be presenting in Africa. We will be presenting in Malaysia. So if you know anyone in Costa Rica, all of those countries are coming up, Australia, New Zealand, and we will have those presentations starting tomorrow. So today is the last day, or the last right now this is the last presentation for today, and you can tell I'm a little tired. Mike, did you have anything else that you would like to add?
Yes, thank you for your professionalism. Thank you for your insights. And I know that what's most impressive to me is as we look at the science that surrounds ribosine and the developing research around glutathione, we find that we are more and more validated by what we have, by who we are, and by the reach of the potential of this company. And so I'm just excited about this opportunity to not be afraid to invite people to look at what we're doing, because we have a level of understanding that is just astounding, and we just need to let people listen to it. So thank you for your leadership on this. And I think as people start to have these conversations and say, come and look at what we've got, the more we look at ribosine, the better it becomes in terms of its capacity to get nutrition and build glutathione. It's no longer an idea. We all understand anecdotally that it's real. We can show you scientifically, and the scientific community is waking up, and we have a marvelous opportunity before us.
Well, thank you so much, Michael. I have just enjoyed so much working with you on this project. And again, if anybody has any questions, please send them to maxtraining at max.com. And thank you so much. And I look forward to seeing all my Canadian friends on Saturday. Take care, everyone.